Sat Sri Akal ji ਸਾਰਿਆਂ ਨੂੰ. Hello everybody, I'm your host Ramneek and welcome to Rooted and Rising. Grab your chai or coffee, settle in, because today's episode is something we all need. Let's be honest for a second. We all Google our symptoms. We all have a panic attack at 2 a.m. and we all say, कल तो ना सेहत दा पूरा ध्यान रखना है और मंडे से ना जिम पक्का जाना है. Today, we are doing something about it. We are talking to a real doctor face to face. With us is Dr. Varun Bajaj, a well known and well loved family physician from Abbotsford. He's a community doctor who sees it all, from sore throat to serious stress, and now even the glow up side of medicine. Dr. Bajaj, welcome to the show.
Thank you.
Dr. Bajaj, sab to pehla apne safar bare dasso. Where did your journey in medicine begin?
Before we dig deep, have a dive into that, thank you for the nice, brief introduction. I want to thank Ramneek and the team behind Ramneek's work here. And I must say, there's a lot of hard work going on behind the curtains. I wish her good luck. And this is a relatively newer podcast, as far as I know. I'm glad I'm here and I'm happy. I'm going to talk about a lot of things. She walked me through before I started. She gave me a little warm up about how the questions are going to be. I'll try to give honest answers and natural as possible. I came prepared, let me be very honest, but I'm going to give very honest, blatant answers as much as I can give. I just told her it gives me vibes somehow how these cups are and all that gives me like coffee with current style workup. But I'm afraid she told me she's gonna ask me some impromptu questions.
Yes.
That's what the scary part is. Everything else, I'm hoping we'll cruise through. So coming to the first question about my journey, how did I come into family medicine, or I should say, into medicine? It's been very natural. Maybe most of your audience know me, or some of them they know me in my background. I grew up in India. I moved here like hardly 10 to 13 years ago. मेरी background, I grew up in India. Primarily, Jay Mekawaki, what changed or triggered me to be a doctor was primarily my dad. मेरे dad the background, he was a pharmacist, but back in India, if you look at it, like he was a very intelligent man. I've grown and seen him doing all levels of NGO kind of work. Plus, even though a pharmacist, hai sige, but he was, as I said, he was a very intelligent man, very involved in the community. He was involved in Rotary Club and in like higher levels of leadership and stuff. So I learned a lot from him. Growing up, I've seen him doing all that kind of work like a typical doctor will do. So like a full scope practice.
Wow.
Because limited resource setting, he used to work in a government hospital. I still remember they call it medical officer. They did not had for years, so he managed that location. I've seen people coming to our houses, even called at 2 o'clock, never regretted. He always came up with something, always helped people. I've seen him tackling emergencies, even worse than what we tackle here, to be honest.
Wow.
I've seen him suturing in that limited resource settings, helping people in crisis, mental health and whatnot, going out of the way, giving. I mean, back then we used to even dispense medicine from home or the hospital. So looking at him was the primary trigger. So I was like, people used to respect him a lot. So I was like, well, it's not about money. It's all about how he used to treat people and people give it back to you. Uh, Actually motivated me. So it's like if I have to, I mean, it gives if somebody like him is around you, not even as father figure, but even as your doctor or somebody who's around you, and they're more calmer. Whoever is seeking the help, they know they're in safe hands. I'm like, I want to be that person. So I still know. I mean, I may not be even 50% what he looked like, but I'm trying to be. Of course, the rest of the environment builds you, makes you. Uh, I have been lucky to be around nicest people around in the world. A lot of support that I felt. I felt the love around where I grew up, and same here as well. I'm feeling. I mean, they say positive vibes, देंगे, you'll get those back. So you develop, you evolve, but that's how the journey started.
Yeah. It's so nice. So your father was your hero.
Yes.
It's lovely. I love that. My hero happens to be my father. And I love how you described your relationship with your dad and how you looked up to him, right, as growing up. Wow. Okay. Dr. Bajaj, medical school is tough.
Mhm.
Being a doctor is tough. But becoming a family physician is another level of tough.
That's right.
Why do I say that? Is because you deal with a lot of people with emotions,
Correct.
right? What made you choose family medicine?
As you probably heard, as you heard my background, anyways, I will say very honest answer is I never started thinking, oh, I'm gonna be a family physician. Yes, the thoughts were, yeah, I'm gonna be in medicine. I'm gonna be in medicine as a doctor who deals with people. That was for sure because I'm
Hmm.
people's person, which I think I am. Um, there's no place for. I mean, I should say back in India, and I had no plans to move here. When I had no plans, I knew okay, I'll be a doctor. As an MBBS doctor, you can practice. At the least, or you have to do is you'll go into internal medicine, which again in India they deal with people. They work like family doctors more
Hmm.
of. When I came here, as I said, I'm gonna be very honest. It's very hard to get in. We all know that.
Hmm.
Being trained in a foreign trained soil somewhere else, you move here, you get in the system. Very hard job. Um, I should say relatively easy, or more what they wanted was family practice. So they have kept those spots open for people because we all need family doctors here in Canada. We all know that.
Hmm.
Going into specialty is a whole different game. So uh, more spots, the resources were such in Canada as well. So they want you to be primary care practitioners. That's what the need of the day is.
Mhm.
And ever since, I have not regretted at all, not even my 1%. I've been loving my job. I do a variety of different things here in Canada. When I started off, I was like, no, I don't want to be a GP. Really, do I want to be? But looking back, I'm looking, okay, I'm doing almost everything I wanted. Work in office, I go to long-term care. I deal with sick old people.
Mhm.
I have chose to go to emergency medicine. I have a flavor of it too.
Mhm.
And as you know, I do a bit of cosmetics as well.
Yes.
So bit of everything. And I think I'm sure there's a lot to come. And I mean, I welcome everything and anything I like. And I try to incorporate it into my practice and have enough flexibility. And again, end of the day, I wanted to be with the people talking. I love those things.
Mhm.
So I've been doing it. It's my everyday.
Making connections.
Making connections, exactly. Yeah. So it was not a choice,
Hmm.
but I love where I am.
Hmm. That's very nice to hear. Dr. Bajaj, this was my next question, but you did mention. So now you've entered cosmetic medicine,
Yeah.
which surprises a lot of people. What inspired that move?
Again, a lot of things like you get dragged into. You look at medicine as or practice as like old traditional style, giving prescribing medications and all. But you see, if cosmetics done in a right way, everyone wants to look beautiful, look
Hmm.
good. That's all about people go to gyms most of the time
Hmm.
rather than staying healthy.
Hmm.
You see how social media is. There are a lot of filters that are out
Oh,
there, and they're
yes.
selling as in like everyone is using it because everyone wants to look beautiful. There is a mental, I mean, there is a psychology behind it.
Hmm.
People are willing to pay money for it as well,
Hmm.
just to look good, right? And in turn, I mean, now is a world when everyone is depressed and sad and all that. Anything that makes you happy for any sort of reasons, why not? Cosmetics is one of the things.
Hmm.
People come in, they want something done to their face or their body.
Hmm.
And end of the day, like when we do something appropriately to them, rightly what they want to be done, like Botox fillers or
Hmm.
anything else, and
Hmm.
we'll talk about that.
Hmm.
They're instantly happy. And if they get compliments from somewhere else, or like, oh, you look good, have you done something? Have you been working out? Or what have
Hmm.
you done? Have you been sleeping well? Have you been hydrating? I mean, people hide sometimes and don't reveal it, but they feel happy
Yeah.
inside. And at the end of the day, if you're making somebody happy,
Hmm.
whatever they want it to be, why not? And being coming from a background, when you have medical background, it's easier for you to practice those things because you're comfortable with needles.
Hmm.
You're not like passing out from the look of the blood and all that, right? It comes to you, it's natural, it's an easy transition.
Yeah,
Everything else follows.
definitely. And I've heard that the world is kinder to pretty people.
Yes, that's a very good saying. True. That's what the goal is, and let's help people achieve that.
Yes. So earlier, or you're still fixing the BP and the cough, but now
Correct.
you're also fixing the jawlines and the glow.
That's right. And people's minds, and they're happier, and in turn, mental health,
Yes.
right?
Okay. So, Dr. Bajaj, you're working in Abbotsford. It's a multicultural community.
Correct.
है ना? Do you have clients who come into your clinic and they say, डॉक्टर साहब मेरे तो ना दिल च काऊ माऊ ਹੁੰਦਾ ਹੈ, ਮੇਰਾ ਇਲਾਜ ਕਰ ਦੋ?
It's funny. ਸਾਡੇ ਕੋਲੇ ਬਹੁਤ ਤਰ੍ਹਾਂ ਦੇ
ਹਾਂ
again, again, if I did not touch on it,
ਹਮ
it's funny how these came. So, and again, it's not a challenge for me in particular
ਹਮ
because I did practice because I've been practicing in India as part of med school and all that. So again, it comes natural. There is no Google translation, trust me, that is gonna convert cow moo and oh hari goli ਨਾਲ ਠੀਕ ਹੋਣਾ ਹੈ,
ਹਾਂ
ਚਿੱਤ ਘਬਰਦਾ ਆ,
ਹਾਂ
ਵਲੇਵੇਂ ਪੈਂਦੇ ਆ।
ਮੇਰਾ ਕਾਲਜਾ ਥੱਲੇ ਨੂੰ ਜਲ
ਮੇਰਾ
ਜਾਂਦਾ
ਐਗਜ਼ੈਕਟਲੀ ਕਾਲਜਾ ਥੱਲੇ ਨੂੰ ਹੁੰਦਾ ਤੇ ਮੇਰੀਆਂ ਲੱਤਾਂ 'ਚ ਕੁਰਮੁਰ ਜਿਹੀਆਂ ਹੁੰਦੀਆਂ,
ਹਾਂ
ਰਾਈਟ? No matter what you do, where you belong to, again, you have to have some context.
ਹਮ
You have to have that experience, but it comes. And then, ਉਹਦੇ ਲਈ ਕਈ ਵਾਰੀ innovative solutions ਵੀ ਹੁੰਦੇ ਹਨ. I'm not going to go over here. And if you have to go to that level, because you got to connect with those people, my
ਹਮ
patients, my clients, right? ਜੇ ਤੁਸੀਂ ਉਹਨਾਂ ਦੀ ਹੈਲਪ ਕਰਨਾ ਚਾਹੁੰਦੇ, and you have to
ਹਮ
understand where they're coming from.
ਬਿਲਕੁਲ
Sometimes a kurmur can be as simple as like chest pain.
ਹਮ
Kalje ਚ ਦਰਦ ਹੁੰਦਾ can be, I've found like people having like subtle heart attacks and they're not good. I mean, if you can connect, you gotta look into it. You gotta know, okay, what they're coming from.
yeah
Sometimes it's all they need is reassurance.
ਹਮ
But you connect hona, you gotta learn that lingo.
ਹਮ
And I have been lucky because I can try and go and relate with them.
yeah yeah
So it helps you a lot and makes your practice easier too. Um, yes, it's funny how things evolve and how people present.
ਹਮ
मैं ਤੁਹਾਨੂੰ ਦੱਸਾਂ ਕਿ it's a very famous saying among all us doctors is कि it's challenging but I mean I'm bilingual, so ਜਿਹੜੇ doctors primarily English speaking, and it's very challenging for them when
ਹਮ
it comes to कि people working in emergency like हो ਕੀ ਰਿਹਾ है ना. uh, uh, yes, yeah, that's a nutshell about being multilingual helps you.
Yes, yes. That was exactly my question that I was going to ask, but you answered it. That how talking in their own language, it helps to break the barriers.
Right.
है ना? Yeah.
Yes,
And ਉਹਦੇ ਚ I think ਤੁਹਾਡੇ dad ਨੂੰ again ਤੁਹਾਨੂੰ thank you ਕਰਨਾ ਚਾਹੀਦਾ ਹੈ because of
absolutely.
the exposure you had back home, right?
Absolutely. I had excellent exposure.
Hmm.
Plus, my friend circle is such,
Hmm.
my community connections are such. I'm still learning, of course.
Hmm.
Yes, being a bilingual, that what was your question was, it's an advantage.
Hmm.
I work in emergency as well. Sometimes the people you already know in your own practice, and not the office, you know them very well.
Hmm.
Sometimes you come across with strangers,
Hmm.
maybe just Punjabi speaking, sometimes Hindi speaking too,
Hmm.
है ना? And they're both similar
Hmm.
languages. Sometimes Urdu, Pakistani.
Hmm.
Um, when you're going across in the hospital, like seeing patients, sometimes you see them in pain, in cry or agony, or they're just sheer anxious ki, oh,
Hmm.
kuch hega ta nahi hega. And they're thinking कि केड़ा डॉक्टर काम कर रहे in their mind most of the time. Okay,
Hmm.
मैं गल करनी किवें होगी. And there are sometimes we're two doctors working, they're thinking, oh, पता नहीं मेरी गल समझूगा कि नहीं. And that's in their heads, by the way,
Yes,
है ना? But
yes.
you can
Hmm.
sometimes read. As soon as you bring them into the room and you're like, Hanji, I'm Dr. Bajaj, introduce myself. And
Hmm.
like, when I know, okay, they speak Punjabi, Hanji, dasso.
Hmm.
And sometimes I look a smile on their face, they blush and like, okay, अच्छा पंजाबी च गल कर सकते हैं. I like, Hanji कर सकते हैं.
Hmm.
And then they go on and on and on. Like,
Hmm.
ਜਿਹੜੀ ਚੀਜ਼ ਉਹਨਾਂ ਨੇ ਦੋ sentences ਚ chest pain triage ਤੇ ਦੱਸੀ ਹੁੰਦੀ ਹੈ,
Huh.
end up getting something else.
Yes.
So, as I said, I'm lucky to have, I mean, I call it still a skill, even though it came as natural, like
Hmm.
being a bilingual, but you end up getting a lot of contextual history from them. And that's
Hmm.
money. Money, when I say money, I mean, that's gold because you know a lot about the background, what's they're
Hmm.
coming from. And during that limited amount of time, ਤੁਹਾਨੂੰ ਪਤਾ ਲੱਗ ਜਾਂਦਾ ਕਿ what they're coming from. Then you can run the test accordingly, you can treat them accordingly.
Hmm.
Is it sheer anxiety versus something going on, है ना?
Hmm.
But as a matter of fact, it's all about connections.
Hmm.
And you have very limited time ਉਦੋਂ ਕਿ ਉਨੀ ਦੇਰ 'ਚ ਤੁਸੀਂ connect ਕਿੱਦਾਂ ਕਰਦੇ ਆ. And that comes into our favor as doctors
Hmm.
because we have limited information. We cannot help them the best. And of course, in turn, it helped them too.
Hmm.
Um, ਜੇ ਉਹੀ ਗੱਲ ਮੈਂ English, especially again, there's some people who come with mental health issues
Yeah.
and it's very hard to express.
Hmm.
Um, But yeah, we try and utilize our skills as much as I can, but it's beneficial, yes.
It is beneficial, definitely. ਜਦੋਂ ਡਾਕਟਰ ਬਜਾਜ ਆਪਾਂ ਡਾਕਟਰਸ ਦੀ ਗੱਲ ਕਰਦੇ ਹਾਂ, ਰਾਈਟ, ਜਦੋਂ ਤੁਹਾਡਾ ਇਹਦਾ ਕਨੈਕਸ਼ਨ ਬਣ ਜਾਂਦਾ ਆਪਣੇ ਫੈਮਿਲੀ ਡਾਕਟਰਸ ਨਾਲ, ਸਮਟਾਈਮਸ ਤੁਸੀਂ ਜਸਟ ਉਹਨਾਂ ਦੇ ਕੋਲ ਜਾ ਕੇ ਬੈਟਰ ਫੀਲ ਕਰਦੇ ਹੋ, ਤੁਹਾਨੂੰ ਉਹਨਾਂ ਨੂੰ ਦਵਾਈ ਲਿਖਣ ਦੀ ਵੀ ਨਹੀਂ ਲੋੜ, ਹੈ ਨਾ। ਸੋ ਜਸਟ ਉਹ ਤੁਹਾਡੇ ਨਾਲ ਬੈਠਦੇ ਆ, ਗੱਲ ਕਰਦੇ ਆ, ਐਂਡ ਉਹਨਾਂ ਨੂੰ ਲੱਗਦਾ ਹਾਂ ਅਸੀਂ ਨਾ ਹੁਣ ਬਿਲਕੁਲ ਠੀਕ ਹੋ ਗਏ। What is that psychology?
Yeah, it's beautiful how it evolves. Again, you talked about connection then, but we're
Yeah.
talking about sometimes mere kole I have some patients jade in their 70s, 80s, and they have been here just speaking Punjabi, है ना। ਕਈ ਵਾਰੀ ਆਉਂਦੇ ਹਾਂਜੀ ਦੱਸੋ ਕੀ ਕਹਿੰਦੇ ਬਸ ਜੀ ਮਿਲਣ ਹੀ ਆਏ ਸੀ ਬਸ ਤੁਸੀਂ ਮਹੀਨੇ ਕੁ ਬਾਅਦ ਸਾਨੂੰ ਬੁਲਾ ਲਿਆ ਕਰੋ ਤੇ ਬਸ ਗੱਲਾਂ ਕਰਕੇ ਕਈ ਵਾਰੀ ਲਿਟਰਲੀ ਆਈ ਹੈਵ ਸੀਨ ਪੀਪਲ ਆਉਂਦੇ ਆ ਹਾਂਜੀ ਖੁਰਖੁਰ ਥੋੜੀ ਜਿਹੀ ਕੋਈ ਦਵਾਈ ਲਈ ਐਂਡ ਦੇ ਐਂਡ ਅਪ ਟਾਕਿੰਗ ਟੂ ਮੀ ਅਬਾਊਟ देयर ਫੈਮਿਲੀਜ਼ ਦੇ ਕਨੈਕਸ਼ਨਸ ਕਿੱਥੋਂ ਆਏ ਕੀ ਕੀਤਾ ਕਈ ਵਾਰੀ ਮੇਰੇ ਤੋਂ ਵੀ ਪੁੱਛਣ ਲੱਗ ਬੱਚੇ ਹੈਗੇ ਆ ਵਿਆਹ ਹੋਇਆ ਇੱਕ ਤੁਸੀਂ ਮੈਨੂੰ ਰਿਸ਼ਤਾ ਲੱਭ ਹਨਾ and they laugh again it's all about it's not just ki you're treating them in some way but sometimes they just come to you ki sometimes they just come with their family issues and coming from a doctor I have to still talk to them as much as I can because everything is related your mental health is related your physical health well-being is all around it and ਜੇ ਉਹ ਕਿਤੇ ਆ ਕੇ sometimes vent out ਹੀ ਕਰਦੇ ਆ and they feel better end of the day you spend with them 10, 15, even 20 minutes end of the day I haven't done anything sometimes magic happens
Yeah.
right and I mean, when I was getting trained here, they talk about psychology, they talk about how you counsel them and all. They have their own template. So, apuchu, you go over that pathway, which is what we talk about. I think it comes naturally to us as where we grew up. जब ਤੁਸੀਂ ਉਹਨਾਂ ਨਾਲ ਗੱਲਾਂ ਕਰਦੇ ਹੋ, and again, in their mother tongue, in this case, Punjabi, uh, most of the time they have things in their own language. Most of the things they have in their head you just have to reiterate them they come up with their own solution it's just you have to talk to them they have to open up sometimes they always when they move out of the room after that discussion ਜਿਹੜੀ ਵੀ ਪ੍ਰੋਬਲਮ ਲੈ ਕੇ ਆਉਂਦੇ even it's mental health or otherwise ਜਦੋਂ ਤੁਸੀਂ ਉਹਨਾਂ ਨਾਲ ਕਨੈਕਟ ਕਰਦੇ ਹੋ ਟੱਚ ਕਰਦੇ ਹੋ they come with like okay maybe I can do this and this and but you have just mediated it but they did not recognize sitting alone at home and all that so coming back to it is like yes it happens it happens because one you're connecting two you speak the language
Yes, yes. And you know how you said about connection? I think this is very relevant when we talk about people need someone to talk to.
mm-hmm.
ਆਪਣੀ ਅੱਧੀ ਬਿਮਾਰੀ ਉਹਦੇ ਨਾਲ ਹੀ ਠੀਕ ਹੋ ਜਾਂਦੀ ਹੈ
correct
ਐਂਡ ਤੁਸੀਂ ਐਜ਼ ਅ ਡਾਕਟਰ ਆਲਰੇਡੀ ਇਨ ਪੋਜੀਸ਼ਨ ਆਫ ਟਰਸਟ ਹੋ ਉਹ ਤੁਹਾਡੇ ਤੇ ਬਿਲੀਵ ਕਰਦੇ ਆ ਆਈਜ਼ ਬੰਦ ਕਰਕੇ ਹੈ ਨਾ ਸੋ ਜਦੋਂ ਤੁਸੀਂ ਜਿਹੜੀ ਗੱਲ ਕਹਿ ਦਿੰਦੇ ਹੋ ਉਹ ਫਿਰ ਸਟੈਂਪ ਲੱਗ ਗਈ ਪੇਪਰ ਤੇ
kind of
yeah
so I'm glad you brought this up. A lot of people need somebody to talk to.
Yes.
Loneliness in this age and era is, as you probably heard about it, it's a disease, it's a problem, it's a huge problem. We're sitting behind such screens and we think we're doing and touching everything. We have all sorts of data, we have all sort of knowledge, but we don't have people to talk to. I'm lucky and we have advantage of being able to listen to people from coming from an expert point of view. Yes, you can put in recommendations on the help we kar sakte ho. Sometimes it's all about just listening.
Yes.
And people don't have people to talk to because they're not comfortable. When it comes from us, we have the ethical duty as well as responsibility ki whatever we talk there, it stays in that room.
Yes. Dr. Bajaj, this brings us to our segment 2. I'm going to ask you some hard questions. Are you ready?
Yeah, I already had a sip of water before. She gave me hands up.
Awesome. Okay, Dr. Bajaj, let's talk about some data because numbers, they don't lie. Right now in Canada, we have 6.5 million people who do not have access to a family doctor. 6.5 million, not a small number.
A lot.
It's more than the population of British Columbia.
True.
Which means there are millions of people who are using walk-in clinics. Emergency rooms overloaded.
Yeah.
Long-term continuity of care, no one's looking at that. When you hear this number, what goes through your mind as a physician?
Absolutely. Let's dissect it a little bit. I 100% agree with the stats. You've done your homework, and those are right numbers, more likely. We all know there's waiting time. We all know we're short of doctors, especially family doctors. It's a system problem.
Yes.
It's a resource allocation problem, in my viewpoint. Again, this is my viewpoint. We as doctors, in my opinion, and as I've seen my colleagues working, we are working hard enough. There's a lot of resources we have to accumulate and gather and delegate to and try and help our patients. But we have limitations. We're human. We're not machines.
Yes.
I've seen my colleagues and even myself. We work hard. We see a lot of people. We try to help. But there are a lot of things that are not in our hands as physicians. Meaning, let's say you want certain tests to be done, a CT scan, for example, or an MRI for any reason. I'm just giving out examples. I'm not specifically mentioning that. Now, look at the population explosion or the influx of population in the last, let's say, 10 years. Have you seen how many new hospitals have you seen being built?
Not many.
Not many, right? How many new doctors have been, recruited?
Not many.
Not many. So again, I'm saying this not because I'm pointing fingers. All I mean is it's a combined approach of everyone, including political. Yeah, we have to work on these things. And again, I think problem can be solved, but I think it's the influx of population, lack of resources, or maybe some allocation problem. I mean, most of the problems can be solved. I'll talk about the good part because we are a government-funded healthcare system. Not a lot of countries do have it, right? Yes, there are lacks. There are lots of big gaps among the healthcare, but on a lot of ends, we're doing a really good job, right? People are getting free healthcare, or I should say, relatively free healthcare. Yes, there are big gaps. It can be from perspective or point of the healthcare force, doctors, nurses, allied healthcares. Yes, actual services we're getting. My point is, it can be fixed, but it has to come from public politicians and, of course, healthcare practitioners. We're happy to get involved, anyways. Maybe the limiting factor can be money, but I think we have to look at it from different angle and try to help each other to accomplish that. It's very frustrating when, even coming from patients' point of view, they have to wait a longer time. There are instances when there are complications when they're waiting. It happens. On the other side, you will come across people asking, I mean, again, I'm not pointing fingers. It comes from ignorance. Sometimes certain people ask for certain tests which doesn't is they're not needed.
Yeah.
If you're coming from a private setup, you can explain it because, oh, you're paying out. Well, you get it done. It's fine. You sleep better. Yes. When it comes from certain tests being asked from certain people which don't need it, acute injury, back pain, no fractures found on back pain, for example, have been asked from a lot of people, oh, why, doctor, why can't I go for MRI? My cousin in India had a back injury. He got MRI done right away. Well, yeah, he paid $5,000 rupees there, and you can get it done there. It's a different healthcare system. You can't compare apples and oranges, right?
Yeah.
You got to compare what? Yes. Now, again, coming from the other end, yes, I agree. There are certain problems, longer waiting times, and people fed up. And that's true. That's real. We got to fix the problem. By we, maybe we together.
Yes, everybody works together
Correct.
for a solution. Dr. Bajaj, there's another reality. It takes weeks to see a physician,
Right.
months to see a specialist,
Correct.
and years to get a procedure done. In that time, disease progresses, frustration builds up, right? And the trust in the system breaks. Is it safe to say that people are not just sick anymore, they are emotionally exhausted with the system?
100%. Now, I'm going to dig deeper more. I agree with what you said. The emotional part is so true. Sometimes it comes from your personal experience, having a bad outcome from waiting, and that's legit and true. A lot of times it comes from listening to other people's stories.
Yeah.
Now, what I'm saying is, as I said in the first hand, it's so right. We have struggled a lot, which we have still been for the waiting time, specialists, da da da. A lot of anxiety also comes from, oh, somebody had a bad outcome and he or she had similar symptoms. Now, or that he or she may have totally different story than what you have.
Mm-hmm.
A lot of anxiety around getting tests and all that may not be so true. But how do we know? And I get it when it comes from a lay person, a person who is suffering from the other end, listening to the stories from their surroundings, there is no legit way they can tell, oh, it's fine. It's probably going to be okay. If I have a breast lump, is it not going to be cancer like my aunt had? You cannot tell until you talk to a doctor and be like, oh, maybe it is just a small, benign, kind of a lesion, or it's not something that you should be worried about. Um, but yes, the problem is real. As we talked about, it
Yeah.
needs to be addressed. And frustration is very natural
Yeah.
and it's going to happen. I don't have a solution. I don't have a magic wand I wish I had.
Yeah. This brings me to my next question. You are someone who sees that frustration in real time,
Correct.
right? You have sometimes people coming into your clinic, they are frustrated. Oh, we called the clinic 5 times. We were on hold for 2 hours. And then the receptionist said there is no doctor available.
Correct.
People are actually fed up with the system,
Correct.
but they can't say that out loud to the system.
Yes.
For them, doctor is the system.
Right.
How does that make you feel when you see that frustration?
Yeah, that's true. And again, that brings me to, if it's in an office setting, hats off to our medical office assistants, and they take away a lot of heat because they get all the bad
Yes.
stuff being said to them.
Mm-hmm.
By the time they come and see us, people are like a bit more calmer and be like,
Mhm.
we are appreciating the way you're helping us and all that. A lot of people will still vent out, and again, it's their right to say so.
Mhm.
Having that said, we are limited. Again, we don't have, if it's a limited resource setting, we have limitations how many people we can see, right? But I personally try my best to help as much as I can for my own patients and clients. Now, for example, limitations are, if you we try to handle emergencies. By emergency, like office kind emergencies, and we keep some spots in my office. I mean, I cannot talk for other people. Again, we have limitations. We have limitations how many people we can see in each day. Um, Two, if it comes to like an emergency, well, you cannot handle in practice anyways. People call and be like, "Oh, I've been sick. I've chest pain, for example."
Yeah.
We're not gonna tell you to wait for 5 days. We're gonna tell, or my like front desk will tell them, "Oh, you know what? Go to emergency." Some people don't. Sometimes they don't like it,
Mhm.
right? And which is fair. Sometimes they appreciate and then they find alternate solution, going to emergency or urgent care center, for example. Now, they are not trained to triage and tell them what exactly you can do. They have very like template like answers to what your problems are. Um, and again, they went out, and when it comes to me, yes, when I understand, then I don't vent out back to them. I tell them, sorry, we have limitations. A lot of people understand that. But again, if the problem is real and they have issues, it's their right to vent out to somebody somewhere. Sometimes we try and offer some solution. Sometimes we are unable to. Our hands are tied.
Yeah.
Again, no solid solution.
Still working on there.
Still working on as much as within our
Yeah.
limitations, right?
Yeah. Dr. Bajaj, all this anxiety, stress, and uncertainty, it doesn't just affect our appointments, it's also affecting our minds and our hearts. This brings me to my next segment, mental health. Anxiety is common, panic attacks are rising, people can't sleep, and overthinking that never stops. Have you seen in your line of work that mental health issues they are increasing now as compared to the previous years?
Short answer is yes,
Mm-hmm.
and there could be different reasons behind it. Mental health is not new, first of all. It's been there for years. Certainly, that has increased, and not only in number, and also in severity as well. Um, Now, are we talking about the reasons here? Yes. I mean, again, this is my point of view. I think loneliness is one of the things, and we don't have people to talk to these days. Two, social media could be another reason. We see lives of peoples on social media, which may not be true. We think they're living like luxurious lives and they're enjoying their vacations and whatnot. We don't see the background work behind that. We don't see their day-to-day life. We only see, oh, somebody had a vacation, for example, or somebody's partying really hard. And we tried somewhere a lot of people feel unhappy looking at somebody else enjoying, or they're feeling, oh, I'm missing out, fear of missing out. Um, Now, in olden days, it was probably not out there. I mean, somebody else is enjoying, they're not posting. Some people know it's not out there in public. Nowadays, it's like easy access communication. You get like 100 notifications, somebody else is vacationing somewhere else. And now you may have the luxury of sitting at home with your family, enjoying your time, but you're somewhere saying, oh, okay, somebody else is vacationing. Why am I not?
Yeah.
And knowing only a part of the picture keeps you depressed, anxious, and all. Again, that's one part. But I think the big picture is still loneliness. Um, you behind the screens all the time, most of the time, and screen times has significantly risen. You don't spend a lot of time talking to people, your friends. Those connections are missing somewhere. And again, there's studies behind it as well. I'm just not just, saying it out loud like this. That's one of the major things, and we need to address it sometimes later. I mean, now we're more into screens. That's going to be hard to tackle, and we're going to have more mental health issues in the near future. And they're emerging, and I'm sure it's going to rise more, and this is going to be difficult to treat. We had to have start looking into solutions right from the childhood days for the kids.
Wow.
Yeah,
That is not good news.
not certainly a good news. Of course, anything new comes up with their own pros and cons. Internet had when the dot-com thing started, people thought, oh, it's going to have problems. Of course, it has bring us a lot of positive things as well. Life has become much easier,
Yeah.
but again, with social media, yes, you're connected with your loved ones, easy, but it has its own downside as well, bringing all sort of problems with it, and it comes with anything. Same example, like when we used to have cars engines were dull. People used to think there's going to be more taken lives. It has made our lives easier, better, but of course there are lives lost because we have accidents and all sorts of issues too. So pros and cons.
Yeah,
We gotta address the negative side of it.
definitely. Dr. Bajaj, in our South Asian community, mental health is still a taboo.
Correct.
ਅੱਛਾ ਜਦੋਂ ਕਿਸੇ ਨੂੰ ਐਂਜ਼ਾਈਟੀ ਆ ਡਿਪਰੈਸ਼ਨ ਹੈ ਆਪਣੇ ਘਰਾਂ 'ਚ ਕੀ ਕਹਿ ਦਿੱਤਾ ਜਾਂਦਾ ਹੈ ਸਟ੍ਰੈਸ ਹੈ ਜੀ ਸਟ੍ਰੈਸ ਤਾਂ ਸਾਰਿਆਂ ਨੂੰ ਹੁੰਦੀ ਹੈ ਬਟ people tackle with stress very differently, right? My way of tackling would be different than yours.
Totally.
Now, when someone doesn't address the mental health issues for a long time, I have read it somewhere that it actually turns into physical pain or ailments.
Correct.
I read it somewhere, I don't know how true that is, that it can even transfer to becoming a cancer. How true is that?
Right. Good question. So the second part of your question is about physical illness related to Hana,
Mental health, हाँ जी.
One, yes, it's a taboo in the East Asian community. Yeah, it's always been like this. थोड़ी इंज things change हुई हैं because awareness create हुई है around it. Yes, that's so true. And we'll come back to it, how to address it as well. दूसरी चीज हैगी when you're mentally stressed. Now, when you say stress, it's you stress, which is good stress, which is oh, you're getting up, you're excited, मैं gym जाना है, I mean, you gotta put new clothes, for example, for reason. या कोई challenge आया and you gonna happily face it. Oh, I'm gonna tackle that. I'm gonna feel good. You stress, it's great. The other kind of stress is everyday chronic stress, है ना? कि everyday things करनी है, yeah, you come up with the problem that's affecting you every day. Now, studies have shown, and this can more medicine point of view is when you're stressed, you're gonna release some stress hormones, cortisol being one of them, dopamine being one of them, other one, right? Now, you need those hormones once in a while, but if it's ਜਦੋਂ ਤੁਹਾਡੀ body ਦੇ ਵਿੱਚ permanently ਵਧੇ ਹੀ ਹੋਇਆ because mental ਹੈ ਤੁਹਾਡੇ hormones ਉਹ rise ਹੁੰਦੇ we call it baseline inflammation. ਜਦੋਂ ਤੁਹਾਡੀ body 'ਚ inflammation ਹੁੰਦੀ and again we're talking very simple layman terms. ਜਦੋਂ stress hormones high ਰਹਿੰਦੇ ਹੁੰਦੇ calming hormones ਜਿਹੜੇ ਤੁਹਾਡੇ low ਹੈ you lose that balance. ਉਹ inflammation chronically ਜਦੋਂ ਹੁੰਦੀ ਹੈ one it causes mental health manifest for sure. People feel tired, ਥੱਕੇ ਹੈ ਨੀਂਦ ਨਹੀਂ proper ਹੋ ਰਹੀ, always thinking, stressed out. One ਤੁਹਾਡੀ mental health is gone, ਹੈ ਨਾ? ਉਹ ਤਾਂ ਆਲਰੇਡੀ ਹੈਗੀ ਫਿਜ਼ੀਕਲ ਹੈਲਥ ਤੁਸੀਂ ਤੁਹਾਡੇ ਸਿੰਪਟਮਸ ਆਉਂਦੇ that you can see yes you can tell ਤੀਸਰੀ ਗੱਲ ਹੈ ਉਹ ਤੁਹਾਡੀ ਬੋਡੀ ਤੇ ਪਰਮਾਨੈਂਟ ਲੌਂਗ ਟਰਮ ਇਫੈਕਟ ਕਿਵੇਂ ਪਾਉਂਦੇ ਟਾਕਿੰਗ ਅਬਾਊਟ ਕੈਂਸਰ that's so true people are obese overweight because ਉਹਨਾਂ ਦੀ ਮੈਂਟਲ ਹੈਲਥ ਨਹੀਂ ਐਡਰੈਸਡ ਹੈਗੀ ਰਾਈਟ ਉਹਨੂੰ ਤੁਹਾਨੂੰ ਇਫੈਕਟ ਕਰ ਤੁਹਾਡਾ ਈਟਿੰਗ ਪੈਟਰਨ ਚੇਂਜ ਹੋ ਗਿਆ ਰਾਈਟ ਤੁਹਾਡਾ ਮੈਟਾਬੋਲਿਜ਼ਮ ਸਲੋ ਹੋ ਗਿਆ ਰਾਈਟ ਤੁਹਾਡੀ ਇਨਫਲੇਮੇਸ਼ਨ ਹੈ ਬੋਡੀ 'ਚ ਇਟ ਕੈਨ ਕਾਜ਼ ਟੂ ਪ੍ਰੀਮੈਚੁਰ ਕੋਰਨਰੀ ਕੈਲਸੀਫਿਕੇਸ਼ਨਸ ਤੁਹਾਡੀਆਂ ਹਾਰਟ ਪ੍ਰੋਬਲਮਸ ਵੱਧ ਜਾਂਦੀਆਂ ਤੁਹਾਡਾ ਬਲੱਡ ਪ੍ਰੈਸ਼ਰ ਦੀ ਪ੍ਰੋਬਲਮ ਹੈਗੀ ਯੂ ਕ੍ਰੋਨਿਕਲੀ ਸਟ੍ਰੈਸ ਕੈਂਸਰ ਦੇ ਸੇ stress is one of the main reasons people are getting cancers again yes but again that doesn't mean ki cancer can only be because of stress but yes it's a very good correlation among those people who stay healthy happy and they have lesser cancers and study have proven that so that I mean, how strong is that association? We're not going to go deeper into that, but that's true. So, bottom line, I think again, we're talking about mental health all the time. Yes, because of physical manifestations as well. But again, doesn't mean that is the only reason. That's one part, but that's big.
That's big. Wow. ਤੇ ਡਾਕਟਰ ਬਜਾਜ ਇਫ ਅੱਜ ਆਪਾਂ ਆਪਣੀ ਆਡੀਅנס ਨੂੰ ਕੋਈ ਸਿੰਪਲ ਪ੍ਰੈਕਟੀਕਲ ਈਜ਼ੀ ਟਿਪਸ ਦੇਣੇ ਹੋਣ ਹਾਊ ਕੈਨ ਦੇ ਕੰਬੈਟ देयर ਸਟ੍ਰੈਸ ਐਂਡ ਐਂਜ਼ਾਈਟੀ
Great question. Now, a lot of things ਜਿਹੜੀਆਂ ਆਪਾਂ ਅੱਜ ਗੱਲਾਂ ਕਰਨੀਆਂ we'll talk about maybe 3, 4 or 5 points. Bottom line, very important. ਸਭ ਤੋਂ ਇੰਪੋਰਟੈਂਟ ਚੀਜ਼ ਜਿਹੜੀ ਆਪਣੀ ਅਗੇਨ ਫਸਟ ਆਫ ਆਲ ਪਹਿਲਾ ਪੁਆਇੰਟ ਇਹ ਹੈਗਾ ਕਿ ਵੀ ਆਰ ਕੌਨਸ਼ੀਅਸਲੀ ਐਡਰੈਸਿੰਗ ਐਂਡ ਅੰਡਰਸਟੈਂਡਿੰਗ ਕਿ ਯੈਸ ਵੀ ਆਰ ਸਟ੍ਰੈਸਡ and a lot of things are man-made meaning a lot of things are in our hand ਕਿ ਆਪਾਂ ਉਹਨੂੰ ਕੰਟਰੋਲ ਕਰ ਸਕਦੇ we're just creating things around it ਉਹ ਆਪਣੀਆਂ ਬਿਲਡ ਕੀਤੀਆਂ ਹੋਈਆਂ ਹੋਈਆਂ when I say man-made you can address those if you want consciously ਉਹਨੂੰ identify ਕਰਨਾ ਬਹੁਤ ਜ਼ਰੂਰੀ that's the first step in my opinion only then we can find out solutions right very underrated one of the things is your sleep
yes
ਸੋ ਮੈਂ ਤੁਹਾਨੂੰ ਐਗਜ਼ਾਮਪਲ ਦਿੰਦਾ ਸਿੰਪਲੀ ਮੋਸਟ ਆਫ ਅਸ ਸਾਡਾ ਇੱਕ ਸਿੰਪਲ ਸੈਟ ਰੂਲ ਹੁੰਦਾ ਕਿ ਲੈਟਸ ਸੇ ਮੈਂ 9 o'clock ਮੈਂ ਜੌਬ ਸ਼ੁਰੂ ਕਰਨੀ ਹੈ ਆਈ ਗੋਟ ਅ ਵੇਕ ਅਪ ਐਟ ਲੈਟਸ ਸੇ 7 o'clock ਯੂ ਹੈਵ ਕਿਡਸ ਐਂਡ ਆਲ ਦੈਟ 8 o'clock whatever time ਹੈ ਨਾ ਜਾਂ 6 o'clock ਤੁਹਾਡਾ ਅਲਾਰਮ 6 7 ਜਾਂ 8 o'clock ਦਾ ਲੱਗੇ you have to get up
correct
do you have time do you have alarm for getting to bed a lot of us don't
no
right do we have set routine a lot of us don't maybe we do have okay ji 10 ਵਜੇ ਪੈ ਜਾਣਾ do we really go to bed sleep do we don't watch reels
we're all guilty
do we end
of
up
that
waking up I mean talking about that I mean I sometimes do it too let's confess that right but question is what are you compromising first thing you're compromising is your sleep now sleep is therapy ਜੇ ਤੁਸੀਂ sleep good ਕਰ ਰਹੇ ਹੋ again we're talking about cortisol levels they go down your stress levels go down if you have slept last night let's say 6 hours 5 or 4 hours you're gonna feel crappy the next day plus the quality of sleep oh ਕਿੱਦਾਂ ਦੀ ਹੈਗੀ ਹੈ most of the times we can control it sometimes we can't but we're compromising with sleep one we short sleep a lot of us you'll be surprised if you look at numbers ਆਪਾਂ sleep ਨੂੰ address ਨਹੀਂ ਕਰ ਰਹੇ so sorry I'm not going too deep into that but sleep is very important
okay
right we all know ki diet important ਹੈਗੀ we all know but we still eat crappy we're very poor with discipline ਆਪਾਂ ਸਾਰੇ ਤਰ੍ਹਾਂ ਦੇ ਬੈਡ you will be surprised ਰਮਨੀਕ ਜਦੋਂ ਮੈਂ ਪੁੱਛਦਾ when a patient comes to me like diet better go when we go oh diet ਤਾਂ ਮੇਰੀ ਬਹੁਤ ਵਧੀਆ ਜੀ ਮੈਂ ਤਾਂ ਤਲਿਆ ਖਾਂਦਾ ਹੀ ਨਹੀਂ
ਅੱਛਾ
when you go deeper you will find there are a lot of red flags
yeah
ਹੈ ਨਾ ਤੇ ਆਪਾਂ ਜੇ ਉਹ ਆਈਡੈਂਟੀਫਾਈ ਨਹੀਂ ਕਰਦੇ now this is the age when you have all the information at your fingertips you are still so ignorant because you don't want to address it है ना so diet is very again we all know that a lot of us who don't ਜਿਹੜੇ the people who win over those two things they are success they do very good in their physical mental health and all that है ना again this is not that we all don't know it we all know it we don't want to address it theory ਬਹੁਤ strong ਹੈ ਆਪਣੀ ਸਾਰਿਆਂ ਦੀ practical ਚ ਮਾਰ ਪੈ ਜਾਂਦਾ ਹੈ ਨਾ third thing I'm a fan of is and again when I'm saying it doesn't mean I'm applying it too for myself which I am regretting I'm guilty of is something called non-exercise activity time NEAT है ना NEAT is like a person can be okay ਤੁਸੀਂ exercise ਕਰ ਲਈ ਇੱਕ ਘੰਟਾ ਤੁਹਾਡੀ everyday life ਕੀ one person is sitting like 7 hours on a seat with in front of the screen which a lot of office work is like ਹੈ ਨਾ ਦੂਜਾ person ਹੈ ਕਿ is on always on your toes ਤੁਸੀਂ exercise ਤੋਂ ਬਿਨਾ ਕਿੰਨਾ time spend ਕਰਦੇ ਹੋ walking around doing stuff doing chores but it doesn't replace exercise still.
Yes.
Let me be very clear
Okay.
because a lot of people come and tell me मेरा work बहुत physical है जी मैं तो सारा दिन तुरे फिरदा हूं."
Huh.
That does not replace exercise, trust me.
Hmm.
Aerobic exercise or cardio
Hmm.
or resistance training, it's totally different field. So
Hmm.
again, the studies are on exercise and NEAT separately.
Hmm.
So I look at them, both of them as two different entities, right? You may have very poor exercise time, but you have a good NEAT, you may be still lean and healthy.
Hmm.
Hannah.
Hmm.
So again, underestimated. So if again, it's all about overall
Hmm.
lifestyle change. So we talked about sleep, we talked about diet,
And then
and
exercise.
then exercise, and then NEAT time.
Neat time. Yeah.
Those are big ones. And of course, it's
Hmm.
very important, Joe Appa already touch base kita hai, or screen and all those times need to
Yeah.
be, that's going to be huge in
Hmm.
coming years. Now, we have studies, ਬੱਚਿਆਂ ਦੀ population ਦੇ ਵਿੱਚ ਬਹੁਤ challenge ਆ ਰਿਹਾ and we're
Hmm.
struggling with screen. Again, we always talk about kids having screen time. Look at your, if you use Apple devices and even Androids,
Huh.
look at your weekly device use. So the screen time, you'll be surprised if you
Yes.
catch it.
Yes. I
Right?
don't want to look at mine. I'm scared.
Exactly. You feel bad looking at it all
Yes.
the time, but we all do that.
Hmm.
Again, this is the time on phone, but jada tosi computer te kam, that's still screen time. So I would say if I have to change something in my life or if I have to advise somebody, that's huge as well.
Hmm. So less screen time.
Less screen time for you.
Noted. Hmm. Okay. Now we are moving on to heart health.
Yeah.
Dr. Bajaj, heart health is huge.
Hmm.
Um, you know, people as young as in their 20s or in their 30s, they are sleeping and they don't wake up. Reason? Silent heart attack.
Correct.
What is causing so many heart attacks?
Let me question you first. Why are we thinking that everyone who woke up or didn't wake up in the morning had a heart attack?
Because that's what we hear.
Right?
ਜਦੋਂ ਆਪਾਂ ਨੂੰ reason ਨਹੀਂ ਪਤਾ ਲੱਗ ਰਿਹਾ, I think mostly, oh, our heart stopped working.
Correct. So we don't know that's real. There's no way to tell. A lot of times we don't even have any investigations to follow up and do that. Any sudden young person dying, a sudden death for any reason is considered heart attack unless proven otherwise. ਆਪਾਂ ਉਹ assume ਕਰ ਲੈਂਦੇ ਆ ਕਿ it's a heart attack. There could be other reasons too. Right? Do we really have to question ourselves कि कोई भी sudden death हुई, could it be a brain bleed for any reason? Somebody had aneurysm, for example. You had arrhythmia, you had a clot in the lungs, you had a massive stroke. I mean, yes, it can be, right? How do we assume कि heart attack है one, right?
True.
Okay, consider it's an heart attack.
Huh.
Yes, there are reasons in our lifestyle that is triggering early heart problems, early like diseases like obesity, hence also causing problems like hypertension, even diabetes, like even apni community ਦੇ ਵਿੱਚ Indian community ਦੇ ਵਿੱਚ, it's like if you talk about Indian population, it's a capital. Even India is called capital of
Yes.
diabetes, right? Key reasons ਹੈਗੇ ਆ overall ਜੇ ਆਪਾਂ overall health markers देखिए that there are a lot of things that are not right in our health. One, ongoing mental stress, है ना? That's affecting us anyways. Lifestyle ਕਿਦਾਂ ਦਾ ਹੈਗਾ, ਆਪਣੀ physical activity ਕਿੰਨੀ ਘਟ ਗਈ ਹੈਗੀ ਹੈ. Those factors, yes, they count. Other things being hypertension, diabetes, obesity, ਸਾਰੀਆਂ ਚੀਜ਼ਾਂ ਜਦੋਂ it is coming into more early age.
Yeah.
A lot of it blaming to food, I think. We're talking about genetics. Can we change them? No. Indian population has been prone to like diabetes, hypertension, especially diabetes. Can't change that. But lifestyle, yes, it can be changed. Now, second thing is a lot of people talk about, oh, it's post COVID, it's happening. It's my opinion as ki, we don't know, first of all, ki is it COVID vaccine? It's too early to tell. But it was need of the day. They built it. They helped us for sure. Any long-term consequences? Are there going to be consequences? We'll know down the lane, right? Ki, are they causing heart attacks? For now, hale tak koi, in my opinion, there's no like very firm, conclusive evidence saying. Otherwise, would have stopped those vaccines,
Yeah.
to be honest. Coming to key, why is it happening is a lot related to A, the lifestyle. B, now it's easier to communicate and we know. Back, let's say 20 years ago, ਕਿਸੇ ਦੀ death ਹੁੰਦੀ ਸੀ for any reasons, right? You call it heart attack or whatever. ਉਹ communicate ਨਹੀਂ ਹੁੰਦੀ ਸੀ. Now today a death happens, a sudden happen, or a celebrity dying, for
Correct.
example.
Mm-hmm.
Within seconds, minutes, you know somebody died. And if it's sudden, you call it, okay, it's heart attack.
Mm-hmm.
We don't know.
Yeah.
But we're knowing more of those, problems happening out there in the community.
Dr. Bajaj, you just mentioned about lifestyle and how people are not exercising, right? It's a reason for a heart attack.
Correct.
But why are so many people dying in the gym?
Absolutely. Uh, Again, that's part of the information we know. Somebody died in some physical situation.
Yeah.
Now, ਜਿਹੜਾ gym exercise ਕਰਨੀ and all. So, you're working out, meaning you're putting your body at strain, means ਤੁਹਾਡੀ heart rate ਵੱਧ ਰਹੀ, you're sweating. Your body is asking to pump more blood. ਤੁਹਾਡਾ heart pump stronger ਕਰ ਰਿਹਾ. Your heart is pumping harder, more heart rate too, right? It's trying to give it, right? It's way higher than ਜਦੋਂ ਤੁਸੀਂ normal days ਦੇ ਵਿੱਚ ਕਰਦੇ ਹੋ, ਹਨਾ? So in that time, if you have something underlying, it can be a blockage, a tiny blockage in the heart. You may have a sudden heart attack. It's not the exercise is causing it. It's just your demand is high. Now, when it comes to heart attack, मैं थोड़ा deeper जा रहा. Heart attack ਕੀ ਹੁੰਦਾ? ਤੁਹਾਡੇ heart ਨੂੰ blood ਚਾਹੀਦਾ itself for its functioning. ਜਿੰਨੀ ਡਿਮਾਂਡ ਜ਼ਿਆਦਾ ਹੈ ਉਹਨੇ ਧੜਕਣਾ ਜ਼ਿਆਦਾ ਹੈ ਜਾਂ ਪੰਪ ਜ਼ਿਆਦਾ ਕਰਨਾ ਮੋਟੇ ਬੰਦਿਆਂ ਲਈ ਸ਼ਾਇਦ ਉਹ ਜ਼ਿਆਦਾ ਚਾਹੀਦਾ ਹੋਵੇ ਬਿਗਰ ਪਰਸਨਸ ਨੀਡ ਮੋਰ एवरीवन हैव देयर ओन डिमांड ਉਹ ਡਿਮਾਂਡ ਉਹਦੀ ਬਲੱਡ ਸਪਲਾਈ ਦੀ ਹੈ ਜਿਹਦੇ ਚ ਆਕਸੀਜਨ ਹੁੰਦੀ ਸਪਲਾਈ ਇਜ਼ ਦ ਬਲੱਡ ਸਪਲਾਈ ਜੇ ਸਪਲਾਈ ਤੇ ਡਿਮਾਂਡ ਚ ਡਿਸਕ੍ਰਿਪੈਂਸੀ ਦੈਟਸ ਵੈਨ ਯੂ ਗॉट ਅ ਹਾਰਟ ਅਟੈਕ ਇਨ ਵੈਰੀ ਸਿੰਪਲ ਲੇਮਨ ਟਰਮਸ ਕਦੋਂ ਘੱਟ ਹੋ ਸਕਦੀ ਜਾਂ ਤਾਂ ਤੁਹਾਨੂੰ ਆਕਸੀਜਨ ਨਹੀਂ ਮਿਲ ਰਹੀ ਯੂ ਆਰ ਇਨ ਅ ਟਾਈਟ ਰੂਮ ਐਂਡ ਹਾਈਪੋਥੈਟੀਕਲ ਸਿਚੁਏਸ਼ਨ ਐਂਡ ਯੂ ਮੇ ਗੈਟ ਇਟ कार्बन मोनोऑक्साइड पॉइजनिंग डा बट मोस्ट कॉमन इज कि थोड़ी आर्टरी ब्लॉक होगी और वो आर्टरी मोस्ट ऑफ द टाइम कि थोड़ी थोड़ी ब्लॉक हो रही एकदम प्लाक रप्चर होया वो बंद होगी एंड थोड़ा हार्ट तो मांग रहा है ना right that's when you get it and then the heart is screaming for all that so dard shuru hunda and all that now with heart attack comes some rhythm problems because it's crying right so rhythm problem ho ji heart ruk gaya you don't get supply to the brain you die right very simple easy language ਜਦੋਂ ਤੁਸੀਂ ਜਿਮ ਵਰਕਆਊਟ ਕਰ ਰਹੇ ਹੋ ਯੂ ਮੇ ਹੈਵ ਸਮਥਿੰਗ ਅੰਡਰਲਾਈਨ ਮੇਬੀ ਤੁਹਾਡਾ ਹਾਰਟ ਸਾਈਜ਼ ਬਿਗਰ ਹੈ ਫॉर ਅਨਲੈਸ ਤੁਸੀਂ ਟੈਸਟ ਨਹੀਂ ਕਰਾਇਆ ਐਂਡ ਆਲ ਦੈਟ ਯੂ ਗੈਟ ਇਟ ਰਾਈਟ ਵੇ ਬਿਕਾਜ਼ ਤੁਸੀਂ ਸਿੰਪਲ ਤੋਰ ਰਹੇ ਹੋ ਕਿ ਵਾਰੀ ਕੀ ਹੁੰਦਾ ਅਗੇਨ ਆਮ ਗੋਣਾ ਟੇਕ ਅ ਪੌਜ਼ ਐਂਡ ਟੇਕ ਯੂ ਵਾਕ ਯੂ ਥਰੂ ਅਦਰ ਸਟੈਪਸ ਕਿਸੇ ਬੰਦੇ ਨੂੰ ਥੋੜਾ ਚੱਲਦਿਆਂ ਦਰਦ ਹੁੰਦੀ ਹੈ ਜੀ ਉਹ ਕੀ ਹੋ ਰਿਹਾ ਹੁੰਦਾ ਕਿ ਬਲੱਡ ਸਪਲਾਈ ਉਦੋਂ ਜ਼ਿਆਦਾ ਚਾਹੀਦੀ ਹੈ ਹਾਰਟ ਨੂੰ ਮਿਲ ਨਹੀਂ ਰਹੀ ਉਦੋਂ ਦਰਦ ਹੁੰਦਾ ਯੂ ਸਿਟ ਡਾਊਨ ਯੂ ਗੈਟ ਬੈਟਰ ਕਰੈਕਟ ਹੈ ਨਾ जिम एक्टिविटी ਦੇ ਟਾਈਮ ਤੇ ਕਿ ਯੂ ਡੂਇੰਗ ਯੂ ਵਰਕਿੰਗ ਆਊਟ ਯੂ ਪੁਸ਼ਿੰਗ ਯੂਰ ਬੋਡੀ ਹਾਰਡ ਬੋਡੀ ਨੂੰ ਹੋਰ ਬਲੱਡ ਚਾਹੀਦਾ ਹਾਰਟ ਨੂੰ ਹੋਰ ਬਲੱਡ ਚਾਹੀਦਾ ਉਹ ਮਿਲ ਨਹੀਂ ਰਿਹਾ ਇੱਕਦਮ ਬੋਡੀ your heart starts and goes into arrhythmia it stops the brain supply and you die that's what happens so most of the time ki hunda we think ki exercise caused it but it's not exercise caused it was underlying something that got exposed simple words and we're just talking heart attack now, coming back to, do we really know it was a heart attack?
No, we don't.
Right?
Yes.
Right? So, if it was a heart attack, there was something underlying happening already, which was masked by the body, or we just ignored the symptoms.
For a long time.
Yes. Now, there are times when you have silent heart attack, yes. But a lot of times there's something going on we may ignore. That's when your screenings come into play. That's why we come into play.
Yes.
You should see a doctor.
And that is my next question. Yeah. They say prevention is better than cure.
Correct.
Right? So if you have to give us any 3 preventative tips that every adult should follow, what should they be?
Are we talking about heart health or are we talking about general?
Let's go general.
Okay. So again, boils down to de-stress, sleep, and we talked about it already. And those are big ones, right? And the third one is your diet and exercise. Simple as that.
And for heart, if I say specifically just for heart.
Yeah. So the most evidence is about exercise, right? If you have other risk factors, you got to address those anyways. If you're diabetic, you got to control it. You're obese, overweight, you got to control it. You have high blood pressure, you must look into it as well. Now, there are genetic factors. Cannot control. You cannot change your parents. You cannot change your genes, right? ਜਿਹੜੇ modifiable risk factors ਹੈਗੇ ਆ ਉਹਦੇ ਚ they say heart health. The most studies ਕਹਿੰਦੇ and we all know that anyways 150 minutes a week you gotta do 30 minutes of aerobic exercise like at least 5 days a week kind of thing. Oh, the most evidence ਹੈਗਾ.
Yeah.
So if you have to do something and any activity, just start with that exercise as simple as 30 minutes a day. It changes a lot. It's not just the weight, it has independent benefits the exercise does have on your heart health too. So if you have to do one thing, that is a thing, and that's aerobic. Now they're saying you have to add in a little bit of a resistance training as part of it too. So look into that.
Yeah.
Now I'm not gonna dig deeper and dive into all those tiny details, but that's in a nutshell.
That's nutshell. And the biggest outcome is exercise.
Yes,
Right.
that's big. And
That's big.
again, we're talking about physical health. It also benefits mental health. And again, there's studies around it too.
Yes, yes, yes. All right, Dr. Bajaj. So this brings us to our next segment. I call it medical myths debunked.
Mhm.
Okay. So, ajkal we have WhatsApp University
Correct.
and Google ne lokan nu adde doctor banaya hoya,
Very
right?
well. And ChatGPT.
Now ChatGPT, you're so
Yeah.
right. So let's clean up some doubts with facts.
Correct.
Ready?
Yes.
Okay. Myth number 1. Drinking warm water melts fat.
Hmm. If that was true, I mean, the gyms would be bankrupted. It helps with digestion. It's not a magic cure.
Yeah.
Then nobody would have been exercising. Then I would have just bought a warm tumbler and warm it up and have a six-pack after. It was that easy.
Yeah. Myth number 2.
Yeah.
Multivitamins are harmless. Take them daily.
Take them, yes. Are they harmless? Not always. You gotta have some opinion, have some expert advice. If you don't need them, if your diet is good, if it is, if you don't need them and you're just taking extra, you're just spending your money and making your urine expensive because most of them you pee it out.
Oh, so not every multivitamin is for everybody.
Well, I've seen a lot, I've heard a lot of crazy stories around it too, and people are using a lot of stuff they don't need it a lot of times. But yes, there are certain things they should be, and I don't think we had that's what podcast yet.
Okay. Next myth is natural matlab safe. जे आयुर्वेदिक है तो ले लो कुछ नहीं थोनू नुकसान दूगा.
Very good. I love this. I मेरे को बहुत बार ये क्वेश्चन पूछा ਜਾਂਦਾ natural doesn't always mean safe. Poison ivy भी safe normal हम natural ਹੁੰਦਾ. Snake venom is natural. Does it mean safe? No.
No.
Provided there is evidence behind it, research behind it, then yes, there's some things. The problem is a lot of natural stuff we use. I talk about Ayurvedic herbal because I get asked this question a lot. I tell them, well, unfortunately, there is not a lot of evidence research about it. That does not mean कि Ayurveda doesn't work. My mom has been practicing Ayurveda as well. I'm a big fan of it, provided it's used correctly. Problem है कि unlike the traditional medicine we're using, like the modern medicine, I should say, Ayurveda च any research नहीं on, but it's been there for like thousands of years.
Yes. Yeah.
So it definitely works, right? Now, does it mean it's completely safe? Doesn't always mean. I've seen bad stories, complications with it, है ना? Like, let's say लसन हैगा, लसन माँ कहंदे किसी ਨੂੰ ਵਾਦੀ ਕਿਸੇ ਨੂੰ ਸਵਾਦੀ, is that what the ਮੁਹਾਵਰਾ is?
I think
है
so.
ना? ਕਿਸੇ ਨੂੰ ਮਾਫਕ ਹੈ, ਕਿਸੇ ਨੂੰ ਨਹੀਂ. Are you overdoing it? Well, it can harm you as well. है ना? ਕਿਸੇ ਨੂੰ ਪ੍ਰੋਬਲਮ ਵੀ ਆ ਸਕਦੀ ਹੈ ਪਰ it's not a solution for everything. Carefully used, if it's not harming you, I'll tell you, okay, there's no point, there's no harm, take it, no problem. You go out for a walk, it's not hurting you, well, great. If you're walking in a jungle and there are snakes out there, you better not do
Yeah,
it.
yeah. So it's hit and trial.
Yeah, hit and trial and be safe.
Be safe.
Yeah.
Next myth. Antibiotics cure everything. Cold, flu, fever. Antibiotic bas de do.
This is my favorite. So now, as we know, antibiotics treat bacteria.
Hmm.
It does not treat impatience,
Hmm.
right? If you're impatient but you have a virus, you'll be like, doctor, mainu antibiotic de do, theek ho ju. It's not gonna help you.
Yeah.
And this is every day I have been asked this question. I have to say no sometimes, a lot of times. There is a reason. ਜਦੋਂ ਤੁਸੀਂ antibiotics ਲੈਂਦੇ ਹੋ and you don't have bacterial infection, which a lot of times we can tell based on your history, symptomatology, what we're doing is as a community, we may end up creating problems with it, which means that the bacteria which are existing in your ecosystem may get resistant to it, and those antibiotics may not work, which is what has happened in last few years. You might have heard about resistant bugs and all that. Inappropriate treatments, partial antibiotic treatments, they cause problems. Now, the antibiotics, think of antibiotic to malaria. You have natural gut bacteria as well. You have other problems like C. difficile, other infection that happen just because you got antibiotic when you even don't need it.
Yeah.
So it's a double-edged sword.
Yeah.
It's not a panacea of all care, as I said,
Yeah.
right? हर चीज का रामबाण इलाज नहीं
है
हैगा,
नहीं है.
even if we think,
Yeah.
right? Now, coming from Indian population and I talk to them and all, people have in their homes India to manga ke antibiotics
Yes.
on there,
Huh.
right? I mean, I often tell my patients, I do not get paid because I'm not writing you prescription. It takes me longer time to convince you. I will do and tell you what is safer and right for you. Now, you're the boss, you do what you want. Right?
Next myth.
Yeah.
Cosmetic procedures always make you look fake.
Okay, great. Cosmetic procedure, if rightly done, they actually boost your morale. That's my opinion on it. If it's done rightly. Some people overdo it, and some people want them overdone. Yeah, that's great. I'm a fan of more like subtle looks.
Yeah.
I mean, sometimes you get compliments like, "Oh, you look fresh. What
Yeah.
did you do? You've been eating well, right?" If you have done it, if rightly done, they're a bliss. They're great,
They're great.
right? If you're overdoing it, well, the way you want it, you can be.
So, do you tell your patients less is more?
It's not always less is more. I tell them custom made,
Oh,
right?
yeah.
If you have a jacket which is custom made as compared to you buy it from a regular store, you're gonna look different.
Definitely. Next myth. Pain is normal, just live with it.
Uh, okay, but pain, I call it, it's not a background noise. When you have pain, your body is trying to tell you something. Listen to your body.
Yeah.
And then talk to someone like me and maybe we can go over it. Always pain does not mean you're doing it right. I've seen and heard stories, people exercising, they had a knee swelling and pain and they probably injured their ligament. They kept on doing it, have ended up having problems.
Yeah.
Yeah, so you got to listen to your body.
Next myth. Mental health is just overthinking.
Yeah, if mental health is overthinking, then therapy is like a shutdown button. Yeah, yes, anxiety and mental health, we already talked a lot about it. Overthink, okay, there is a very fine line, right? So you're एक particular चीज ਲਈ how much you're thinking, are you overthinking? Are you anxious and it's affecting your health, mental health, physical health? So that you know intermingled line or whatever boundary we call it, sometimes different, hard to differentiate for someone like you if you're talking to yourself. That's why it helps to talk to other people and see maybe I'm on the other end and I need help from a doctor or a psychologist or whatever, right? So it's not always clear line.
Last myth. This is my personal favorite, and I personally want to ask you. Gym ਕਰਨ ਨਾਲ ਬਾਲ ਝੜ ਜਾਂਦੇ ਆ.
Okay. Then फिर सारे trainers गंजे होंगे. Well, it's genetics and
Yeah.
hormones and sometimes lifestyle.
Huh.
Yeah, a lot of time it's genetics, and that turns out to, lead to, hair loss and all. Sometimes there's certain things like iron deficiency and all those things. Again, there's no right, exact one-line answer to it, but exercise is definitely.
Awesome. I'm so glad to hear that. Dr. Bajaj, now this is my favorite segment. I want to talk about cosmetic procedures.
Yeah.
You know, there's this infamous Bollywood saying, "Jo Bhagwan nahi deta, wo doctor deta hai."
Uh-huh.
How true is that?
जो भगवान ही देता है वो बोटक्स लेता है. Yeah, now we all know it's out there. Everyone knows how. I mean, back in, I don't know, 1980s, It was a luxury to have Botox fillers and all those like fun treatments. People used to think, oh, how is he or she so young?
Hmm.
We have, and then now it's within reach of every common person. It's, I think, more affordable.
Yeah.
And things have been getting better and all. Now, Botox fillers and all those fun treatments, you get it done. Everyone wants to look good, and there's nothing bad with it.
Hmm.
That's why a lot of people work out. Their motivation is to look good rather than to stay healthy, to be honest.
Yeah.
And that it comes down to like makeup and stuff. Now, the cosmetics, like cosmetic treatments like Botox fillers, and if you have within your reach, why not?
Hmm.
If
Yeah.
you in your 50s can look like 40s or in your 40s and look like 30s, why not?
Why not?
Why
That's so
not?
true. Yeah. Acha, Dr. Bajaj, has anyone ever come to you with a celebrity photo and be like, Dr. Saab, mainu idda da bana do?
Yeah, we come across. There was a client who came to us and like, I want to look beautiful, and like again, the definition of every person of beautiful can be different.
Yes.
I haven't have exactly the example nahi hai, but I have people who come across to us and be like, I want to look beautiful. Like, what do you mean? You want your, let's say, cheeks chiseled, or your chin to look great, or you want your crow lines to go away, or you want your headlines, which is like, wrinkles there to go away.
Yeah.
What is your? You have nasolabial folds. You want them to go away. Okay, or you want your nose, it's crooked, and you want to make it a bit more straighter and maybe look more Tinkerbell, as you call it. So I always ask and deal in, okay, what do you want? I mean, it's not me who want what I want. You should be happy with something.
Yeah.
Can we do it is next question, right? And how much we can do. And again, every person's need can be different. As I said, tailor made. I love it. I love the term. And then that's how we work with it and on it.
Nice. Okay, what is trending right now? Is it lip fillers, jawlines, or like fix my tired face?
Fix my tired face. So true. Again, it's very important overall picture. What's trending? Can't really tell you the answers now. There are a few things. Botox has been there for a long time. Now we do fillers as well. So of course, it makes you look. It gives you a little plump look, and you gotta. I mean, again, there are a lot of things we can do. We do thread lifts as well in our office. So thread lifts are you put threads, they're collagen and they stimulate. They let you, I mean, if you have saggy skin, you make it more chiseled looking, right? You can have more defined.
Snatched look.
That's right. That's right. Some girls they like more fox eye look. Again, it's a thing you want or not, right?
Yeah.
Nose, I do non-surgical rhinoplasty, which means you have a little dimple in there and you want to make it more straighted, more sharper looking one. Some girls they like Tinkerbell nose. So it's all about putting in fillers. So there are a lot of things. Obviously, laser treatments and all those. There are other things. Oh, we do PRP as well. PRP is platelet-rich plasma. So we take your blood, spin it. We take the rich proteins, inject it back into you. Also used for hair loss. And other treatments for erectile dysfunction in men and O shots in women as well. But in nutshell, if you talk about face, PRP is another treatment. We do microneedling to make your skin glow and all that. What is there one particular thing trending than others? I can't really answer, but there's a lot of fun stuff out there which maybe I haven't heard of in the last, maybe 10 years ago. Now we're more into it. It's a constantly evolving, changing,
Yeah.
and it's selling.
It's selling, definitely. So people don't have to go to Turkey anymore. They can come
Not
to you.
anymore. Yes. Unless you want to sit in that hot air balloon and enjoy that, right?
Who's more worried about wrinkles, men or women, in 2025?
Actually, both, I should say. You'll be surprised how men take care of themselves as well. Yeah, traditionally we think women do or overdo whatever, depending on how your experience is. But men are getting into it and they're willing to spend money and time and energy. And yes, so I would say I don't have real stats to support it, but I'm seeing a lot of men who want to get things done on them.
Oh, wow.
Yes.
That's
And
interesting
they
to
may,
know.
I won't be surprised if they overtake women in terms of cosmetics and they're like, well.
Yeah. Dr. Bajaj, cosmetic treatments used to be a secret.
Correct.
Now people are posting it right away on Instagram.
Are they?
Yes, they are.
Maybe not everyone.
Okay, yes.
A lot of our clients say, well, it just stays here. I don't want to overdo it so it looks like I actually get it done, which we totally respect that and try to accomplish. A lot of them, they don't want their pictures posted and they don't post their pictures either saying that they have gotten something done. and call it, oh, I'm natural and I take care of my health. I drink a lot of fluids, and well, what's nothing wrong with it. And then a
Yeah.
word of Instagrams and all those
Hmm.
filters out there. I
Hmm.
mean, nobody gets offended.
True. मैं तो पूरी natural हूँ.
आपकी तो वजह से आपकी स्किन का पता ही नहीं चलता.
पता एज का पता ही नहीं चलता.
And she goes, I don't care.
Yeah. Okay, one last question. This is serious but still fun.
Mhm.
So, have you seen anyone, any example that how cosmetic treatments have actually improved someone's mental health?
Oh yes, all
Hmm.
the time. We were talking about ki how um again I was giving you example. If you compliment somebody
Hmm.
and you see them walking after that, ਉਹਨਾਂ ਦੀ ਕਹਿੰਦੇ ਨਾ ਤੋਰੀ ਬਦਲ ਗਈ.
Huh.
That kind of impact and magic happens.
Hmm.
If you're looking good and you get two compliments, even if you don't, if you look into the mirror and
Hmm.
you feel happy about you, your way of thinking changes, your attitude changes, and your motivation changes a lot.
Hmm.
So all the time, if you're happy, healthy, and you look good, and you get compliments on the top, your day changes,
Bilkul.
right?
Yeah.
And of course, mental health is all about how your environment is, how you're thinking.
Hmm.
And yes,
Hmm.
sometimes we appreciate, sometimes we don't, but it's there.
Hmm. Yeah.
Absolutely. How you look changes how you think.
Yes, and how you feel.
How you feel. When you feel happy,
Yeah.
it's all about it.
Hmm. So compliments are very kind. Audience, you should give compliments to everybody.
Make sure you comment with nice,
Yeah.
nice
Okay.
words there.
Yes. Dr. Bajaj, I want to address one tough topic. Now, my question to you is when something goes wrong, doctors are often the first one to get the blame, right? Negligence,
Mhm,
lawsuits,
mhm,
complaints.
mhm.
How heavy is that pressure on doctors?
Absolutely. And that's real.
Hmm.
When you're talking, okay, first of all, let's start by saying we as doctors have responsibilities. We're responsible for your health. Of course, you are as well. There will be time when you may not be right, or your doctor may not be right, or he or she has been negligent. There are consequences. And in real world, it happens, yes. Now, the two aspects to it. One, a doctor is negligent, didn't do what needs to be done, and you had a bad outcome, well, it's not unheard of. Does it happen every day, all the time? Maybe not, if you're cautious and you're good. Two, your doctor did everything right, did all the right tests, did all the investigations right. You had an outcome which could not have been prevented. Well, is it anybody's fault? Maybe not. It's bad luck. Now, I'll so we can't change much about
No.
it. Somebody had a massive heart attack.
Hmm.
Is the doctor responsible? No. You were diagnosed with a cancer, it was missed, never happened to have symptoms, you caught with it. Doctor's problem or doctor's fault? Not, probably not. First part is what I'm gonna address more. Let's be fair. Let's talk about, yeah, can a doctor be wrong? Absolutely. Now, when it comes to my approach in personal, or a lot of our doctors in Canada, what we have been taught. If you did something, a bad outcome happens, you look into the background. What did you do? What a fair, normal doctor would have done. I personally ask if I think we have done something wrong or we had a bad outcome. One, I review the charts again, look into data, look into research. Um, have you heard about blind spots? Like you're doing something, you don't know what's happening, but somebody else can see it. I ask my peers and ask for their opinion. And let's be honest, we have to be. I ask them to get, critique me. Is there any one single thing could have done that? Yeah, it's difficult. Let's be honest, but you gotta have that peer view, like within a closed room, confidential kind of a thing. And then, yeah, if you think you identify some problems or patterns in your practice, you better address it. That's my approach. Am I ideal? Am I 100% correct? Will I be correct all the time? Will I not make mistakes? No, that's not right. Every human being, and being a human being, you're going to make mistakes. The problem is when you're saying, I made a mistake, I'm not going to admit, I'm not going to correct, then you're not growing.
Yeah.
Then you're being adamant. And again, I will say, I'm saying it out loud here, but is it that easy task? No. But if you have a pattern, a workflow to look for problems, and if you cannot identify and make it better in your next few years of your practice, you're gonna be in trouble at some point. Nobody wants to be in trouble. So I have to look into that. Do still bad outcomes happen? They do,
They do.
right? Are there consequences? Yes. And if you made a mistake and you actually did it, you got to admit it, right? Sometimes it happens because it's you're coming from other end and people think, oh, you did something, well, you got to have consequences, may not be right. Now the system is such that if somebody have a complaint against you, can be college or lawsuit or anything, right? Everything has a fair principle. There are other doctors involved. They will look at you like any other doctor will happen. If you had a consequence when you had something rare happening, if less than 1%, I'm giving example, less than 1% people could have done. Did you do all the right tests to do it? Didn't catch it? Great. You did your job. You cannot, you're not God. And
Definitely.
everyone understands that. So the system is such, they look you from an angle any normal practicing doctor in Canada or North America would have functioned looking back. You may not change the consequences in that scenario, but they will give you feedback about could have done anything different. Sure, that's how system works. Is it pressure? Is it litigation? It's more so in US than in Canada, but it's still there. Are there pressures for doing a fair job? Yes, and we signed up for it.
Yeah.
I'm not regretting what I'm in. It's a responsible position I'm sitting in, so I gotta do my job seriously.
Yeah. And I'm sure you're doing a commendable job.
Thank you. Trying to.
This brings us to our last segment. This is rapid fire. So, rapid questions, rapid answers, no
Is
explanation.
there a hamper?
Not yet. We're not
No
here
hamper?
yet.
Okay, that's fine. We'll get
Okay. So, ready?
Yes,
All right, let's go. Tea or coffee, your morning energy?
kind of both.
One home remedy you think actually works?
Smile.
If you weren't a doctor, what would you be?
Maybe I love public speaking, so I would maybe be a motivational speaker.
That is
Selling
so
to
awesome. Okay, are you a night owl or an early bird?
Used to be night owl in the hostel. I used to wake up until 4, had a poha and sleep. Now more like a morning person.
Yeah.
Yeah, I try to incorporate yoga at 6 o'clock in the morning.
Some days.
Some days. Yeah, let's be honest.
One thing patients do that instantly annoys you. Sachi sachi dasyo.
Sorry, I missed that.
One thing patients do that instantly annoys you.
Okay. Can I have a longer answer?
Okay. Yeah.
So a lot of time we come across people come prepared, they do their homework. Not annoys me, but I'm more vigilant and listen to them. I have to have that level of answers because their level of understanding is higher.
Okay.
But when it comes to when I offer a solution and they say, like, oh, it's not gonna work for me, then I question why it's not gonna work. Let's say you have some sort of let's say example nose problem, or my son had or my cousin had this problem. That doctor gave something like this is the same medicine, it's not going to work. I was like, what did your cousin have? Maybe totally different than what you're having. Why can't how can you tell if you haven't even tried? So that annoys me when you say it's not going to work. So what are you here for? So usually the end point is they have thought of something somebody suggested they want that.
Correct. Yeah.
And again, nothing. I mean, again, that's part of my job. I get to live with.
Okay. One thing that patients do that brings you a big smile.
Oh, good. Compliments. Everyone likes compliments. I had a patient, I think a couple weeks ago, prepared a little memento saying, you are the best doctor on it. And actually, she meant it because she was trying to talk to me and she was literally in tears. She's like, you're always there for me. I mean, we get compliments a lot of times. Sometimes they're not so real, but no, who's there who doesn't like compliments?
Yeah.
But I was touched when she mentioned those. And I had another student with me and she was like, oh, well, great. And we put that little memento in my office as well. It's like a few lines written out it on a glass. And I put it in my office and I put it at my front so other people can see.
This is.
I like showing off too.
Okay. What is your favorite way to de stress after clinic? Netflix, gym, chai?
Yeah, my favorite. I have a favorite hobby. Nothing enthusiastic. I have sip of chai in the evening and like to snooze after on the sofa.
That's the best.
Yeah, yeah.
Okay. Cosmetic procedure everyone secretly wants.
Huh. I don't have a single answer to it. Everyone has their own thing, but most people like to hide the wrinkles when they're in their 40s, in my opinion,
Yeah.
and then and don't want to tell their partner sometimes as well, which is fine,
Which is
right?
fine.
Yeah, yeah.
Okay, one health myth you want to delete forever.
Yeah, there's some people come with cholesterol uh, lowering medications, lesson and all.
Mm-hmm.
I don't know if it's true, but they have it. Karela curing diabetes, for example. But surprisingly, I have noticed people using Karela and all, the sugars down आएंगे without दवाई तो. But what I'm constantly thinking in the back of mind is maybe they're conscious, they're aware.
Yeah.
They're doing, I'm sure they're doing other things too. In Karela खांदे तो maybe वो मिठा जरूर परहेज कर दे होंगे.
बिल्कुल बिल्कुल.
So I'm a strong believer in if you know consciously something,
Yeah,
if you're trying to address it, no matter what you use, you will have some benefits.
definitely.
If you're just ignoring it, that's when most people suffer.
Yeah. Last question. One health rule you wish everyone would follow.
I would say exercise. It's a hard one. Everyone
Yeah.
knows. I wish, or maybe it's gonna happen. Exercise is gonna be obsolete. Maybe we'll have some shortcuts, and there are some shortcuts nowadays.
Let's talk about that shortcut before you go. Yes.
Okay, go ahead.
Okay, the big word today, Ozempic.
Ozempic, Mounjaro, the couple.
Yes.
Wegovy. So what's the question?
My question is, I know it works because I've seen some people.
Absolutely.
Definitely works. Will that effect remain forever, or is it just for some time?
The effect doesn't stay forever. There's nothing
Okay.
that's permanent. It helps with weight loss. They do help. They work, and there's a lot of research around it. Yes. It helps with your metabolism. It helps with your satiety. You eat less. You're less hungry. They do work. Will they be permanent? No. They call it adjuncts. ਮਤਲਬ ਜੇ ਤੁਸੀਂ ਡਾਈਟ ਖਾ ਰਹੇ ਹੋ ਪ੍ਰੋਪਰ ਤੁਸੀਂ ਲਾਈਫਸਟਾਈਲ ਪ੍ਰੋਪਰ ਹੈ ਤੁਹਾਨੂੰ ਐਜ਼ ਅ ਐਡ ਆਨ ਹੁੰਦਾ ਪਰ ਇਨ ਇਟਸੈਲਫ they work really good. If you're not doing anything, still they work. They're pricey.
Yeah.
They have some side effects as anything else. Even Tylenol has side effects, right? Lasan di gandi does have side effects too, right? So everything does have side effects. Do they help as adjunct? Absolutely. That's why they're getting sold. People are buying it. Bollywood stars are doing it. And nowadays, I mean, a lot of my people, my clients, my patients ask for it, and I do prescribe. Now, there's a cost associated. If you're willing to pay for it, yes. Does not replace your lifestyle, anyways.
Yeah.
The effectiveness also depends on how your overall lifestyle is. Will you ever stop it? Yeah, you may have some, rebound. I shouldn't say rebound, but yes, you will. You will, if that effectiveness is there, if you skip that dose or you, to see your drug stop, kar do, so yes, you have to maybe work harder on it. You want to kickstart something and you want to lose some weight. Yeah, it's absolutely for it. Again, doesn't replace your lifestyle.
Yeah. So it is safe to say that many people that we see on Instagram now who had not lost their weight in years and now they're all skinny and posting their gym photos right away.
Yeah.
They can have that shortcut, huh?
Absolutely. Right. You don't know. You don't know what's going on. You'll just see the tip of the iceberg and you just see those fancy new photos again. Could be magic of the camera angle. Could be they're actually working out really well, or they have used something like Ozempic or Mounjaro. This was very insightful. Right.
Thank you so much, Dr. Bajaj, for your time. Thank you for being so honest. Thank you for being so open. This is what this platform is about. ਅੱਜ ਆਪਾਂ ਬਹੁਤ ਗੱਲਾਂ ਕੀਤੀਆਂ ਹੈ ਨਾ ਸਿਸਟਮ ਦੀ ਰਿਐਲਿਟੀ ਕੀ ਹੈ ਆਪਾਂ ਗੱਲ ਕੀਤੀ ਮੈਂਟਲ ਹੈਲਥ ਦੀ ਆਪਾਂ ਗੱਲ ਕੀਤੀ ਕਸਮੈਟਿਕ ਪ੍ਰੋਸੀਜਰਸ ਦੀ ਐਂਡ ਆਲਸੋ ਦ ਰੀਅਲ ਸਾਈਡ ਆਫ ਬੀਇੰਗ ਅ ਡਾਕਟਰ and on behalf of my entire community, I thank you wholeheartedly for all the hard work that you do for us.
Thank you so much. It's been a pleasure. I felt like it's very comfortable space to talk honestly about all the things. It's been amazing. Thank you for all the honest questions.
Thank you so much, Dr. Bajaj.
Thank you.
And to my lovely audience, if this episode made you pause for even a second and think about your health, your habits, your stress, it's a win. You don't have to change your whole life tonight, but take small steps. Drink more water, take that short walk, call someone you have been meaning to, or finally book that appointment that you have been delaying. This is Rooted and Rising. Thank you so much for watching. I'll see you in the next episode. Until then, apna khayal rakhiyo.